Every morning you wake up, your hands feel stiff, your knees ache before you even stand. You try to open a jar, and the pain shoots through your fingers like a warning. You've been living with arthritis for months, maybe years, and you've tried everything: the pills, the creams, the exercises. Some days are better than others, but most days you just wish you could move the way you used to. What if I told you there's one vitamin, just one, that could change everything? A vitamin so powerful that it doesn't just ease the pain, it actually helps repair the damage inside your joints. Most people over 60 have never heard of it. Doctors rarely mention it, and the few who do don't explain how critical it is for arthritis. But here's the truth. Without this vitamin, your joints will keep breaking down. The inflammation will keep spreading, and the pain will keep stealing the life you deserve to live. I'm not talking about calcium. I'm not talking about vitamin D or magnesium. I'm talking about something far more targeted, something that goes straight to the root of arthritis and starts rebuilding what's been lost. And today, I'm going to show you exactly what it is, how it works, and how you can start using it to take back control of your joints, your movement, and your independence. But you have to stay until the end. Because what I'm about to share isn't just information. It's a roadmap to less pain, more mobility, and a body that finally feels like yours again. Let's begin. Before we talk about the vitamin, we need to understand what's really happening inside your joints when you have arthritis. Arthritis isn't just one condition. It's actually a group of conditions. But the two most common types are osteoarthritis and rheumatoid arthritis. And both cause pain, stiffness, and swelling. But they do it in different ways. Osteoarthritis is the wear and tear kind. Over the years, the cartilage in your joints, that smooth, cushiony tissue that helps your bones glide against each other, starts to break down. It thins out, it cracks, and eventually, bone starts rubbing against bone. That's when the pain really hits. Because your body wasn't designed for bone-on-bone contact. It's like running a machine without oil. The friction creates heat. The heat creates inflammation. And the inflammation creates pain. Rheumatoid arthritis is different. It's an autoimmune condition, which means your own immune system starts attacking your joints by mistake. It sees the lining of your joints as a threat and sends inflammation to destroy it. Over time, that inflammation damages not just the cartilage, but also the bones, ligaments, and tendons around the joint. And just like osteoarthritis, the result is pain, swelling, and loss of movement. Picture this. You're trying to bend down to tie your shoes, but your knees won't bend the way they should. They feel locked, stiff, like rusty hinges on an old door. Or you're trying to hold a coffee cup, but your fingers won't grip properly. They ache, they feel weak, and you're afraid you'll drop it. That's arthritis stealing your freedom, one joint at a time, one movement at a time. And here's what most people don't realize. The pain you feel isn't just coming from the damaged cartilage. It's coming from the inflammation that's spreading through the entire joint. Your body is trying to heal the damage, but without the right nutrients, it can't keep up. The inflammation keeps building, the cartilage keeps breaking down, and the pain keeps getting worse. That's where this one vitamin comes in. Because it doesn't just reduce inflammation, it actually helps your body rebuild the cartilage that's been lost. Now let me show you what that vitamin is. The number one best vitamin for arthritis is vitamin D. I know what you're thinking. Vitamin D? That's for bones, right? And yes, you're absolutely right. Vitamin D is essential for bone health. But what most people don't know is that it's also one of the most powerful anti-inflammatory nutrients your body can use to fight arthritis. Here's how it works. Vitamin D acts like a regulator in your immune system. It tells your immune cells when to attack and when to calm down. When you have enough vitamin D, your immune system stays balanced. It fights infections when it needs to. But it doesn't attack your own joints. But when you're deficient in vitamin D, that balance breaks. Your immune system gets confused. It starts overreacting. It sends inflammation to places it shouldn't, like your joints. And that inflammation accelerates the breakdown of cartilage. Studies have shown that people with low vitamin D levels are far more likely to develop arthritis, and those who already have arthritis experience more pain, more stiffness, and faster progression of the disease when their vitamin D levels are low. One major study published in the journal Arthritis and Rheumatology followed over 2,000 people with knee osteoarthritis for 5 years. The researchers found that participants with the lowest vitamin D levels had nearly twice the rate of cartilage loss compared to those with adequate levels. That means vitamin D isn't just easing symptoms, it's actually protecting your cartilage from further damage. But that's not all. Vitamin D also helps reduce the production of inflammatory molecules called cytokines. These are the chemicals your body releases when it's trying to fight something off. But in arthritis, they get released too often and too aggressively. Cytokines break down collagen. They weaken the cartilage structure, and they cause the swelling and pain you feel every day. Vitamin D helps shut down that inflammatory response, giving your joints a chance to heal. I remember a patient named Dorothy, 68 years old. She came to me with severe knee pain. She could barely walk across her living room without wincing. Her doctor had told her she might need surgery within the year. But when we tested her vitamin D levels, they were dangerously low. Less than 20 nanograms per milliliter, when the optimal range is between 40 and 60. We started her on a daily vitamin D supplement, 4,000 international units. Within 3 months, her pain had decreased by more than half. Within 6 months, she was walking a mile every morning without any discomfort. She didn't need surgery. She just needed the right nutrient at the right dose. Now you might be wondering, how do I know if I'm deficient? And how much should I take? Let me break that down for you. Most people over 60 are deficient in vitamin D, and they don't even know it. The reason is simple. As you age, your skin becomes less efficient at producing vitamin D from sunlight. Your kidneys also become less effective at converting vitamin D into its active form. And if you spend most of your time indoors, which many older adults do, you're not getting enough sun exposure to begin with. Add to that the fact that very few foods naturally contain vitamin D, and you have a perfect storm for deficiency. So how do you know if you're deficient? The symptoms are subtle at first. You might feel more tired than usual. Your muscles might feel weaker. You might notice that your mood is a little lower, especially in the winter months. And of course, if you have arthritis, you might notice that your pain is worse, your joints feel stiffer, and your mobility is declining faster than it should. The only way to know for sure is to get your vitamin D levels tested. It's a simple blood test called 25-hydroxyvitamin D. Your doctor can order it for you, and it's often covered by insurance, especially if you have arthritis or other chronic conditions. Once you know your levels, you can take the right action. If your levels are below 30 nanograms per milliliter, you're deficient. If they're between 30 and 40, you're insufficient. And if they're between 40 and 60, you're in the optimal range. For arthritis, you want to be in that optimal range, because that's where vitamin D has the strongest anti-inflammatory and cartilage-protecting effects. So how much should you take? Most experts recommend between 2,000 and 4,000 international units of vitamin D, 3 per day for adults over 60. Some people with severe deficiency may need more, at least temporarily, but that should be done under medical supervision. Vitamin D is fat-soluble, which means it's best absorbed when taken with a meal that contains healthy fats. So take it with your breakfast or lunch, along with some avocado, nuts, or olive oil. And here's an important tip. Always choose vitamin D3, not D2. D3 is the form your body uses most effectively. D2 is synthetic and doesn't raise your blood levels as efficiently. Now, let me show you how vitamin D works together with other nutrients to give you even more relief. Vitamin D is powerful on its own, but when you combine it with a few other key nutrients, the results are even better. The first nutrient is vitamin K2. Vitamin K2 works hand in hand with vitamin D to make sure calcium goes where it's supposed to go, into your bones and teeth, not into your soft tissues or joints. When you have arthritis, calcium deposits can sometimes form in and around your joints, making them even stiffer and more painful. Vitamin K2 helps prevent that by activating proteins that guide calcium to the right places. The recommended dose is about 90 to 120 micrograms per day. You can find it in foods like egg yolks, aged cheeses, and fermented foods like natto, or you can take it as a supplement. The second nutrient is magnesium. Magnesium is essential for converting vitamin D into its active form. Without enough magnesium, your body can't use the vitamin D you're taking, no matter how much you consume. Magnesium also helps relax muscles and reduce inflammation, which means less pain and stiffness around your joints. You can get magnesium from foods like spinach, almonds, black beans, and dark chocolate, or take a supplement of about 300 to 400 milligrams per day. The third nutrient is omega-3 fatty acids. These are the healthy fats found in fish like salmon, mackerel, and sardines. Omega-3s are some of the most powerful anti-inflammatory compounds in nature. They work by blocking the production of inflammatory molecules and promoting the production of molecules that help resolve inflammation. In other words, they don't just stop the fire, they help put it out and clean up the damage. Studies show that people with arthritis who take omega-3 supplements experience less joint pain, less morning stiffness, and better overall function. Aim for about 1,000 to 2,000 milligrams of combined EPA and DHA per day. You can get this from fatty fish or from a high-quality fish oil supplement. And finally, vitamin C. Vitamin C is essential for collagen production. Collagen is the main structural protein in your cartilage. Without enough vitamin C, your body can't rebuild the cartilage that's been damaged by arthritis. Vitamin C also acts as an antioxidant, protecting your joints from oxidative stress, which accelerates cartilage breakdown. You can get vitamin C from foods like oranges, strawberries, bell peppers, and broccoli, or take a supplement of about 500 to 1,000 milligrams per day, preferably in divided doses. When you combine vitamin D with K2, magnesium, omega-3s, and vitamin C, you're giving your body a complete toolkit to fight arthritis from every angle. Now let me show you the lifestyle habits that make all of this work even better. Taking the right vitamins is critical, but if you really want to reduce arthritis pain and protect your joints for the long term, you need to support those vitamins with the right lifestyle habits. The first habit is movement. I know it sounds counterintuitive. When your joints hurt, the last thing you want to do is move them. But gentle, low-impact movement is one of the best things you can do for arthritis. Movement keeps your joints flexible. It strengthens the muscles around your joints, which helps support and stabilize them. And it increases blood flow to the cartilage, bringing in the nutrients it needs to heal. You don't need to run marathons. Just 20 to 30 minutes of gentle activity each day. Walking, swimming, yoga, or tai chi. Anything that keeps you moving without putting too much stress on your joints. The second habit is hydration. Your cartilage is made up of about 80% water. When you're dehydrated, your cartilage becomes brittle and less able to absorb shock. That means more pain with every step. Aim for at least 6 to 8 glasses of water per day. More if you're active or live in a hot climate. The third habit is weight management. Every extra pound you carry puts about 4 pounds of pressure on your knees. So if you're even 10 pounds overweight, that's 40 extra pounds of pressure on your knee joints with every step. Losing even a small amount of weight can make a huge difference in how much pain you feel. You don't have to be perfect. Just a little lighter can mean a lot less pain. The fourth habit is sleep. Your body does most of its repair work while you sleep. That includes rebuilding cartilage, reducing inflammation, and healing damaged tissues. If you're not getting 7 to 8 hours of quality sleep each night, your body can't keep up with the damage being done to your joints, and the inflammation keeps building. Create a bedtime routine. Keep your room cool and dark. Avoid caffeine and screens before bed, and give your body the rest it needs to heal. And the fifth habit is stress management. Chronic stress raises cortisol levels. Cortisol is a stress hormone that increases inflammation throughout your entire body, including your joints. When you're stressed, your arthritis gets worse. When you're calm, your body can focus on healing. Find what helps you relax. Deep breathing, meditation, time in nature, spending time with people you love. Whatever it is, make it a daily habit. Now let me bring this all together and show you exactly what to do starting today. All right, you now know that vitamin D is the #1 vitamin for arthritis. You know how it works. You know what other nutrients support it. And you know the lifestyle habits that amplify its effects. Now let's put it all together into a simple daily plan you can start today. Morning routine. Take 2,000 to 4,000 IU of vitamin D3 with your breakfast. Add a source of healthy fat like avocado, eggs, or nuts to help it absorb. Take 90 to 120 micrograms of vitamin K2 and 300 to 400 milligrams of magnesium with the same meal. Drink a full glass of water. Midday. Take 500 milligrams of vitamin C with lunch. Go for a 20-minute walk. Gentle, easy, just enough to keep your joints moving. Drink another glass of water. Evening. Take 1,000 to 2,000 milligrams of omega-3s with dinner. Eat a meal rich in anti-inflammatory foods, fatty fish, leafy greens, colorful vegetables, and whole grains. Spend 10 minutes stretching or doing gentle yoga before bed. Drink one more glass of water. Before bed. Take the second 500 milligrams of vitamin C if you're splitting your dose. Practice deep breathing or meditation for 5 to 10 minutes to calm your nervous system. Go to bed at the same time every night to support your body's natural repair cycle. That's it. Simple, sustainable, and powerful. Within a few weeks, you should start noticing less pain, less stiffness, more ease when you move. And within a few months, you might feel like you've gotten years of your life back. Now let me leave you with one final thought. Arthritis doesn't have to steal your life. It doesn't have to keep you from doing the things you love. And it doesn't have to define your future. Yes, the damage is real. Yes, the pain is real. But so is your body's ability to heal. When you give it the right tools, the right nutrients, and the right support, it can do extraordinary things. Vitamin D is one of those tools. It's not a miracle cure. It's not going to make your arthritis disappear overnight. But it can slow the progression, it can reduce the inflammation, and it can help your body rebuild what's been lost. And when you combine it with the other nutrients and habits we've talked about today, you're not just managing arthritis. You're actively fighting it. You're taking back control. I've seen it happen hundreds of times. Patients who thought they'd never walk without pain again. Patients who thought surgery was their only option. Patients who had given up hope. And then they made one small change. They started taking vitamin D. They added the right nutrients. They moved their bodies gently. They took care of themselves. And slowly, their pain decreased. Their mobility improved. And they started living again. You can do the same. Starting today, starting right now. Your joints have been working hard for you your entire life. They've carried you through every step, every dance, every hug, every moment that mattered. Now it's time to take care of them, to give them what they need to keep going. Because you deserve to move without pain. You deserve to live without limits. And you deserve to feel strong, capable, and free in your own body. Now I want to hear from you. Are you dealing with arthritis right now? Have you tried vitamin D before? Or is this the first time you're hearing about it? Share your story in the comments below. Your experience could inspire someone else to take action today. And if you're ready to take control of your joint health and learn more simple, natural strategies to reduce pain and stay active after 60, hit that subscribe button. Every week, I share science-backed tips designed specifically for people who want to live longer, move better, and feel stronger. Because you're not just aging, you're thriving, and I'm here to help you do it with less pain, more energy, and more hope every single day. Thanks for watching, and I'll see you in the next one.